Hello everyone, so I'm Anne James, I'm the Chief Executive here. Really lovely to see so many of you joining us today, and it is very much a state-of-the-art building, and when you go round on your tours later on you will see that. But in particular I'm really touched by the conference room that we've got here. This will enable support groups to meet once a month whenever they like, but the group does meet once a month, and it's very much in honour of one of our consultants, Salva Natali, who is sadly no longer with us. Now, state-of-the-art facilities like this don't just happen by chance. It has taken, I think, literally years, his life, probably quite a lot of mine, to really build the case for change, to say, actually, our patients, not only are the numbers increasing, but we really need the most fantastic facilities. And I have to give absolute credit to the team who have worked so hard. In particular, and it is one big team effort here, Paul Hunter-Campbell, who I know has worked tirelessly to not only make the case for change, but to really ensure that it was done in the spirit and the design that he knows will work best for patients. And he's been very much supported by Anna Wilson, who's the lead cancer nurse, and Tracy Whittingham, all of whom have been the real force for good and energy around this. I'd also, though, like to thank the estates team, because they're often the people that are not at the forefront or seen to be at the forefront of such developments. And again, I think they've done the most incredible work being part of that patient partnership and with the team to get this built and get this ready in time that, as you can see, we have patients using today, and that has been absolutely brilliant. So thank you to all of you. It is, as I like to say, always a great team effort at Derriford, and of course I don't have magic money myself, so it's really been helpful, incredibly helpful, to have the support of the national team to help fund this facility.
Hi, I'm Paul Hunter-Campbell. I am a urology consultant and I'm the service line director for urology in Derriford Hospital. And I'm also a trustee for the Chestnut Appeal for Men's Health, which basically seeks to advise and give information about men's health, particularly in relation to cancers, particularly prostate, penile and testicular cancer. The Chestnut Appeal started nearly 25 years ago. We're about to have our 25th anniversary, so it's very fitting that we're about to move into a brand new unit for urology. And the Chestnut Appeal has certainly sponsored and helped us make this a really lovely facility for patients. The vision that I had about 6 years ago was to create a facility that was all integral in terms of the investigation and to a degree treatment of a lot of the urological conditions that we see. And so 5 years later we finally managed to get to a stage where we're about to open this fantastic facility for the people of Devon and Cornwall.
Hi, I'm Tracy Whittingham and I'm the unit manager for the Chestnut unit. So we treat patients with urological cancer, so bladder, kidney, prostate, testicular and penile cancer. We are currently in a really small location, and the unit that we work in is too small for what we need to do. So we've been really lucky and given some money from the national team to develop our unit, and this is a really exciting opportunity for us to be able to develop the cancer services for urology within the southwest and hopefully become a flagship clinic for the whole of the country. So that's our plan going forwards. It's going to be really brilliant, I think, for our team. I'm really excited for our patients, for all of our members of staff. For the new people that are joining us, we've increased our establishment so we can hopefully deliver the gold standard service to all of the urology patients in Plymouth and the surrounding area. So I'm super excited. It means a lot to have got it over that final hurdle. It's a really good opportunity as well for our staff and for our workforce. From a wellness perspective, so at the moment we currently don't have a staff room, we don't have a place for people to go and eat or get off the unit. So to be able to be given this opportunity to have proper offices and a proper place for lunch and to support the wellness of our team is absolutely brilliant. So we're really excited and everyone's really looking forward to the move.
This new facility and unit is going to allow us to see a lot more patients. We currently see about 500 patients a week for investigations, and that's going to almost double, I suspect, over the next 5 years. It also means that patients can have all of the investigations that they need in one site. There'll be no more trailing around the hospital with multiple appointments and multiple locations. So it's going to make it much easier for those who have mobility issues and sometimes learning disabilities. We're also going to be able to hoist patients, so patients with wheelchair are going to have easy access to all of the facilities also. So all of these are much improved on the facility that we had previously. So we're all very excited to move in the very near future, and we look forward to welcoming you all to our brand new unit.